It's a good-looking crowd here today, and I'm so happy to be able to stand up here with you guys and tell you a little bit about Navigate Recovery and what we do. But before I get to that, I just wanted to mention how important reentry and addiction recovery is, and not only to this group, but it's evidenced by the people that are here today. Governor Deal, obviously, what a great advocate he's been in this area. Senator Underman, who has been a tremendous asset to our community, reforming addiction care in our community. Greg Kennard, who is our representative here today, who's going to get to speak after me, probably do a much better job too, I bet. He looks better, I can tell you that. And so that just speaks to the importance of the subject. So as the slide said, I'm Farley, Barge. I'm a person in long-term recovery, and currently my condition's been in remission for over 17 years. In fact, 17 years, 3 months, and 1 day. And my recovery has allowed me to be a better husband to my beautiful wife, a better father, a son, a brother, an uncle, and a better citizen. And I'm able to stand up here today and speak to a crowd like this, and so recovery actually works. Along with that, I also blessed to be the co-founder of Navigate Recovery with my wife Susan, and our great team, all of whom are at the table here. If y'all don't mind making a stand up for just a moment, give them a round of applause. As you can all see, clearly Susan is the better half of the group, and I'm thankful she is the face of recovery in our community. Our vision here at Navigate Recovery is pretty simple. It's a community that treats addiction as a chronic condition and those that are affected with dignity and respect. Why do we treat it as a chronic condition? Well, because it is. It's medically accepted, and it's now scientifically proven that it's not much different than any other chronic medical condition, be it diabetes, heart condition, cancer, you name it. But we don't treat it that way. In dignity and respect. Doesn't everybody deserve to be treated with dignity and respect? Our mission is to serve individuals and families affected by addiction, connecting them to the resources that they need, and to remove barriers that prevent them from getting and staying well. We are an authentic recovery community organization, which is an independent, nonprofit organization led and governed by people, guess what, in recovery. Recovery community organizations are an important part of the continuum of care for recovery because we encourage peer-based support services in the community, and we fill gaps in the current continuum of care. So we step into that place and we walk alongside people for a season to connect them to recovery. But I want to have a little audience participation here for a second. So if I could ask you a couple of questions, just 2 questions, it's really easy. How many people here know someone that's been affected by the addiction crisis? Okay, I think it's pretty safe to say that everybody's hand went up on that one. Okay, here's question number 2. How many people have someone in your immediate family that's been affected? Uncle, brother, sister, mother, father? Well, look around. Just take a look around. Keep your hands up for a moment. Just take a look around. I would say about 80% of us have fallen into that category, maybe 90. Believe me, I get to ask that question a lot. And every time I get the same results. And I want you to know that you're not alone. This is not an isolated disease that we're facing here today. In fact, here's some numbers for you if you want to put some parameters around it. 25% of U.S. children live with a parent who abuses alcohol. 20% of all newborn substance exposure begins prenatally. 50% of children in foster care are there due to prenatal substance abuse. 80% of children in welfare cases involve substance abuse. 70% of victims of sex trafficking are substance abusers, and 90% of domestic violence involves substance abuse. Of course, there's homelessness and bankruptcy and workplace productivity, suicide escalation, a whole host of other reasons that addiction impacts everyone in our community. But here's one that's a little closer to home for this group. According to the National Institute on Drug Abuse, in June of 2019, in a report, they say that the substantial prison population in the United States is strongly connected to drug-related offenses. Some research shows that an estimated 65% of United States prison population has an active substance use disorder, and another 20% were under the influence of drugs or alcohol at the time they committed a crime. 85%. 85% of the people in our jails and prisons are there because of addiction. Folks, we can't incarcerate our way out of this problem. But we must have a balanced approach that includes law enforcement, that includes the judicial system, that includes appropriate treatment and aftercare. Aftercare. Here, we're going to drill down a little bit more. Here's some numbers right here in Gwinnett County. Since 2012, we've had a 106% increase in overdose deaths. Now, that's all overdoses. That's not just the opioid crisis we're talking about, by the way. I don't know if you heard about the report last week. The GBI says the opioid crisis is bad, but meth is worse. More people are dying in Georgia from meth overdoses than they are opioid overdoses now. But I'm going to drill down a little bit further. I'm going to get a little more personal. That's my grandkids. And that cutie in the back, that's Abriana. Abriana's 10 years old. And my wife, Susan, and I were blessed with the opportunity to raise her for 7 years of her life because her mom, who was pictured in the video just before me, wasn't able to care for her. And like many families faced with a medical crisis, we stepped in the gap and we took care of her. And we raised her. We did what was necessary for our family. And that little guy in the front, his name's Denver. He's going to be a year old soon. It's hard to believe. He was about 8 months old when that picture was taken. And like his sister, he's born into a family who have a long history of alcoholism and drug addiction. We're genetically predisposed to it. And like our family, we know that there's a strong likelihood that they may have to seek treatment in their lives, or their children may need treatment. And we don't want them to have to experience the struggles that we went through when their mom wasn't able to get the help that she needed. For 10 years, we worked at that, trying to get her help. Now, Susan and I are both people in long-term recovery. We're actively involved in addiction and support recovery in our churches. We are still very involved in that today, as you will see, and we thought we knew a little bit about this. And as difficult as it was in my own recovery, I can tell you that when a loved one is being affected, it was almost overwhelming, and at times it was. We spent time in every major medical, mental health facility in the Atlanta area, and I can tell you that we would anxiously wait for a phone call when we were going to have an opportunity to meet with those professionals in those facilities and talk about how we could address this as a family. And we would get that phone call, and after a few times around, we realized that when the phone call came and they said it was time for the family session, that was really code for your insurance has run out and you need to take your daughter home. And the last time that we experienced this, we sat with a social worker in a major medical facility here in the Atlanta area, and for about 30 minutes we talked about making a plan and how we could step away from this and things could be better. And at the end of that discussion, the young lady handed us a list. It was one page, front and back. I told you that Susan and I have been around support and recovery, and we thought we knew a little bit about this, so we looked at the list and we realized that about half the places that were on that list were not even in existence anymore. And what was even worse was at the bottom of the page, they had printed the date. The list was 3 years old. Now, folks, I think we can do a better job than handing out 3-year-old lists to people and tell them, good luck, we hope you have a nice life, we'll see you next time. That's no way to treat addiction. You won't find us handing out a list at Navigate Recovery, by the way. But let me show you something else. This is what recovery looks like. That's a family in recovery. We are a family in recovery. That's our daughter, Carson, the one you saw beforehand, with our grandson, Denver, and Abriana with her dad. And as you can see, now Mom has a little over 5 years in recovery. Yes, thank you. She's reunited with her daughter. Dad's in long-term recovery too, by the way, and then you can see the look on that little girl's face. It's amazing. Recovery happens, folks. People do recover from this. In fact, in Gwinnett County, there's almost 93,000 of us. Guess what? We're your neighbors. We're your coworkers. You're standing next to us in the line at the grocery store. We're sitting next to you at church, at your place of worship. There's probably a few of us in this room. I know over on this side there is. And that's our team right there. That's several of our team members. And believe me, we know how to have fun in recovery too. I'll tell you a little bit about our programs, and I'm going to step away and just let you know that we have two primary programs that we're running right now. The first one is our Lifeline ED program. Through our Lifeline program, we're able to provide recovery coach services. And what's a recovery coach? That's a person that's in long-term recovery. So this is peer-based supports. And we do that in all 5 of the Gwinnett County Hospital emergency rooms within 60 minutes of receiving a call when someone has experienced an overdose or at risk for an overdose or alcohol. So that includes not just opioids, that includes all the substances and alcohol. And guess what? We do this 24/7, 365, and it doesn't matter if that call comes in at 2 in the afternoon or 2 in the morning. In fact, I think we had one just day before yesterday. Yes, Tori's nodding her head. We'll be there within 60 minutes to meet with that person. We connect with that peer in the emergency department, and then we offer them encouragement and support. We try to get them connected to recovery. But that's just the beginning of the relationship. With their permission, we follow up with with them weekly for the first 90 days. Every week, we place a phone call. And then bi-weekly, every other week for the next 90 days. And then monthly for up to a year. And why do we do that? Well, because studies have shown that if people can get connected to recovery and stay connected to recovery for up to 5 years, they are likely to stay in recovery for the rest of their lives. See, my grandma used to always tell me, if you want to learn how to do something well, you ought to hang out with people that know how to do that. Right? Common sense, isn't it? So what's next? Well, the continuum of care in our county is growing. Thank you, Trey. Due to Trey's efforts and Greg's efforts and others, but it's not nearly enough. So in a few short weeks, we're planning to open the doors of our new women's residential recovery center called Lightway Recovery in Flowery Branch in Hall County, just over the county line, not very far, just past McEver Road. The property is a former bed and breakfast, which when we're complete with the renovations will be able to house 25 to 30 women in a long-term residential program where they'll be supported with dignity and respect as they begin their journey to a lifelong recovery. Why do we choose women? Well, we have a daughter that suffered. Also did mention that we have 4 other daughters, so that's 5, and a granddaughter, right? I didn't mention all the female cats that we have. And, but now we got a grandson, so I think God's prepared me for this, don't y'all? God has a plan. So finally, I just want to say thank you for letting me talk and listening to me blabber on up here. I want to thank you, our good friend Russell Gray. Thank you, Russell. Because what you don't know is that Russell was one of the first people that met with our daughter when she was incarcerated here in Gwinnett County Jail. And he was also her pastor at her wedding. So Russell and Nancy, you have a special place in our hearts. So I also want to say thank you to GGRA, Rachel and Brent, wherever you are, Brendan, I'm sorry, and for the important work that you're doing here. And I want to say thank you to all of you for coming here today and listening to me speak.